Do you experience exhaustion that feels like you have a boat anchor chained to your leg? Do you feel so drained that even simple tasks feel near impossible to start or finish? For patients of mine who either have a diagnosis of cancer or an advanced organ illness, this sensation of persistent fatigue can be very debilitating and frustrating. In this video, I will be discussing evidence-based strategies and treatments to help reduce fatigue related to cancer and advanced organ illnesses. The recommendations might surprise you. Let's talk about it. Welcome to Palliative Care Explained, a channel aimed at answering your questions about palliative care. My name is Dr. Jonathan Wong, and I'm a palliative care doctor based out of Winnipeg, Canada. Please see the welcome video for my declaration that I do not have any conflicts of interest or any financial sponsors, and for the medical legal disclaimer statements. I will leave a link in the description box below. In part 1 of this series, we discussed the many different causes of fatigue. In the setting of cancer or an advanced organ illness, fatigue is most likely the result of several things happening at the same time. Well, if there are several things happening, how do you approach treating fatigue? The first steps would be to optimize the things that are in your control and to identify potentially reversible causes. Let's start with talking about cancer. We know that cancer-related treatments are draining. Some of the side effects and the treatment-related burdens are outside of your control. But what you might be able to control is how you manage and pace your energy. For example, in the days before and after your treatments, take care that you do not overschedule your days. Then, I would encourage you to think about how you approach the tasks and obligations that you have to perform. For example, you may want to consider breaking up one big task into smaller, more manageable tasks and spread over a longer period of time. As well, consider how you physically perform a task. You may be able to conserve energy by sitting at the kitchen table to prepare a meal instead of standing at the counter. Now, everybody's different, so find the approach and the pace that's right for you. People keep telling me to rest and sleep more in order to conserve my energy. Is that what you're saying? No. Please don't get me wrong. I am not telling you to sleep all day and to do nothing. Quite the opposite, actually. More on this later in the video, so please stay tuned. Let's now talk about sleep hygiene. I'll be honest with you here. This has always been a difficult topic. I am certain that many of you have had your medical team tell you to avoid caffeine after certain times of the day, to avoid electronic screens before bedtime, and to maintain a regular sleep location and routine. And that is all great advice. But I also recognize that this can be very difficult to maintain. So similar to pacing your energy, do what you can here. I'm not very good at this myself, but we should all still try. Good sleep hygiene also advises the avoidance of napping during the day. But many of my patients have to take naps in order to preserve their physical and mental function. In these cases, the best suggestion would be to take short naps, no longer than 15 to 30 minutes, and best in the early afternoon. Longer naps and napping later in the day is more likely to cause insomnia and difficulty sleeping at night. You may need to set an alarm to ensure that your naps do not exceed 30 minutes. In part 1 of this series, we discuss how the layering of several different medications, or polypharmacy, can result in more drug interactions and side effects, with fatigue being a potential end result. Now, it's difficult to make broad generalizations here, as everybody's medication profiles will be different. So it's best to discuss your unique medication list with your medical team. They can then work with you in streamlining your medications. Shifting gears a bit, I want to highlight that just because you have a diagnosis of a cancer or an advanced organ illness doesn't always mean that there are not additional treatable medical causes of fatigue. Everybody's situation is unique in terms of which investigations are most appropriate, tolerable, and the most high yield. In part 1 of this series, I discussed various potential medical causes of fatigue. Some of these may be reversible, but unfortunately, some may not be. Your medical team can advise you on the best course of action and the available investigative and treatment options. Now, very importantly, your medical team should work with you in managing your overall symptom burden. Physical symptoms such as ongoing pain, shortness of breath, and nausea can contribute to draining your energy. Having these symptoms treated can make a big difference in your overall fatigue and quality of life. What about in the scenario where I've already optimized what I can, and my doctor tells me that it's my cancer that's the main cause of my fatigue? What then? Here, we have good research data and evidence to guide our practice. In 2024, the American Society of Clinical Oncology, ASCO for short, and the Society for Integrative Oncology, SIO for short, published an update for the treatment guidelines for adults experiencing cancer-related fatigue. This group reviewed over 100 different randomized control trials in order to provide these recommendations. I will leave a link for this, along with additional references in the description box below. Let me summarize the results, and then we can talk about each of the findings. What this group found was that exercise, cognitive behavioral therapy, and mindfulness-based programs led to improvements in cancer-related fatigue both during and after the completion of cancer treatments. Qigong and Tai Chi and the use of American Ginseng showed benefits during treatment, whereas yoga, acupressure, and moxibustion helped to manage cancer-related fatigue after completion of treatment. This group found that the use of dietary supplements did not improve cancer-related fatigue during or after cancer treatments. And in patients towards the end of life, both cognitive behavioral therapy and a short course of corticosteroids showed benefits. With regards to other medications, this group recommended that clinicians not routinely prescribe antidepressants, wakefulness agents, or psychostimulants for cancer-related fatigue. Okay, let's break these down. Firstly, exercise. Remember earlier in this video where I clarified that I am not suggesting that you sleep and rest all day? Exercise, including home-based walking, gentle aerobic, and resistance-based exercises, have been shown to be effective in reducing cancer-related fatigue. I barely have enough energy to get off the couch, and you're asking me to exercise? It will seem daunting at first, but the benefits of exercise in this setting are consistently seen. Now, I am not telling you to hit the gym and pump iron. Exercise activities must be tailored to the patient's physical abilities and tolerances. Having a physiotherapist recommend certain exercises and movements would be a great first step. I would also encourage you to start slow and gradually build your tolerance back up, but keep moving as much as you can. As a word of caution, there are scenarios in which exercise might not be recommended or safe to do. So please speak to your medical team to better establish what is safe and to tailor a plan that will best suit your situation. All right, let's talk about Qigong and Tai Chi. Qigong in general terms, involves self-directed gentle movements, a focus on one's breathing, and meditation in order to combine energy or qi from the body with one's mind and breath. Tai Chi is a type of Qigong that features more sequential or structured movements, but the health approach and perspectives are similar. It is believed that the combination of the exercise component with the mind and body approach results in improved fatigue. Yoga is another ancient practice that combines body movements with meditation and breathing. It can also be an effective form of exercise and mind and body practice to help alleviate fatigue. Now, which one is right or best for you? That might depend on your physical capabilities or limitations. Both Qigong and Yoga have a range of impact and physicality levels, although Qigong is generally considered to be lower impact. Having a coach or instructor can help ensure that you are getting the most out of the practice and that it is being done properly and safely. This segues into mindfulness strategies and cognitive behavioral therapies. Mindfulness interventions can help patients by reframing negative thoughts, can help with the acceptance of the present moment, improve anxiety levels, improve perceptions on quality of life, and help improve sleep. All of these, in turn, can improve cancer-related fatigue. The diagnosis of cancer can cause a myriad of ill effects on the brain. Negative thoughts and emotions, if left to fester, can directly lead to non-ideal coping strategies and spiraling behaviors. The cycle tends to worsen and can be truly exhausting. What cognitive behavioral therapy, or CBT, seeks to do is to have you better process and manage these negative thoughts and emotions, allowing you to break out of the cycle. Now, the specific processes involved in mindfulness practices and CBT interventions are beyond the scope of this video, so I encourage you to seek out providers and instructors near you for more information. These services are often provided by cancer centers and integrative health centers. What about traditional practices or remedies? There are many traditional practices handed down through the generations that promise boosted energy levels. In this setting, however, the ones with supporting evidence and recommended by the ASCO-SIO guidelines are acupressure and moxibustion. If these practices appeal to you, I would encourage you to search for experienced practitioners near you. These can play a role in managing fatigue after your cancer treatments are complete. You mentioned ginseng and corticosteroids. Can those help with cancer-related fatigue? Yes. Let's start with ginseng. It is hypothesized that the active ingredients in ginseng have a dampening effect on some of the inflammation-inducing cytokines associated with cancers. There is also a proposed antioxidant type effect, and together, this could be why ginseng is effective in treating cancer-related fatigue. The caveat here is that the active ingredients can vary in quantity between the different types of ginseng. As well, the method in which it is extracted and prepared can also have an effect on how well it works. So best to speak to your dietitian about which form of ginseng is the right approach for you. Corticosteroid medications, such as prednisone and dexamethasone, is commonly used as an anti-inflammatory to treat a variety of cancer-related symptoms. As described in a previous video, it can also have a role in appetite stimulation, where we are making good use of a known side effect. Another known side effect of corticosteroids is increased energy, and this is why it is commonly used to treat cancer-related fatigue. Unfortunately, corticosteroids can also cause a long list of side effects. As such, although it can be effective, it is best used only as a short-term solution. Now, for my patients who are closer towards end of life, on occasion, we do prescribe wakefulness or stimulant type medications, such as methylphenidate and modafinil. Now, in my experience, these can work well, but at other times, the side effects outweigh the benefits. In general, these types of medications should only be considered if other treatments for fatigue have been found to be ineffective. What about in non-cancerous advanced organ illnesses? Are there fatigue treatment guidelines for those? Unfortunately, fatigue directly caused by organ illnesses has not been as well studied. But the overall approach to fatigue and the treatment recommendations are actually very similar to that of cancer. In illnesses ranging from congestive heart failure to respiratory illnesses to neurological conditions, consistent themes in the treatment of fatigue include gentle exercise, better pacing of one's energy, stress reduction through mindfulness practices, improving sleep, and to optimize other medical complications where possible. Also similar to cancer-related fatigue, stimulant medications and wakefulness agents have a limited role here and should not be used as first line. To conclude and summarize this video, what we have learned from research to date is that our brains and minds play a significant role in how we experience fatigue. Retraining how our minds process and manage negative emotions and being accepting of the present circumstances can go a long way towards alleviating one's fatigue. The role of exercise, in addition to the physical benefits, has a mind and body component that can help with stress reduction. Medications, in the right setting, can be effective in the treatment of fatigue, but the medical research to date demonstrates that a holistic approach, incorporating exercise and mind and body practices, can be much more effective than using pharmaceuticals alone. Thank you very much for watching this video. I hope it was helpful. Until next time.